This is Mike with New Bedford Guide here with Dr. Miller. Going to talk about migraines. So, who are you, Dr. Miller? What's your background?
Well, I'm Dr. David Miller. I'm the Medical Director of Northeast Medical Research, or NEMR as we say here. We're a research site based here in Dartmouth, Mass. And have been doing clinical trials here. Not me particularly, but the site has been doing clinical trials for over 50 years. And a lot of the medications that are developed for use in the marketplace have actually been developed here at NEMR.
So what are migraines? Because there's headaches and there's migraines. Is there a difference?
Well, I think, a regular headache is something you feel lousy, it's something that, hurts for maybe an hour or two, you take some ibuprofen or Aleve or Tylenol, it goes away. But migraines are typically more of a pulsating, throbbing, really severe type headache. And the difference between a regular headache and migraine is migraines typically are associated with nausea, vomiting. You get the light hurts your eyes, even sound hurts your eyes. These are things that typically make the headache feel worse, and they typically can last anywhere from several hours to several days. And so think of it like a regular headache is the minor league, but the migraine headache more of a major league headache.
And you're conducting studies right now in Dartmouth.
Yes, we've been doing migraine trials for a while. There's a whole new science in terms of treating migraine headaches. Typically, migraine headaches are affected by a chemical imbalance in the brain. There are certain chemicals that are released during migraine headaches that cause the blood vessels to open up and more blood flows into the brain. And typically, that's what causes the throbbing. These chemicals also affect the pain centers in the brain. So there are new classes of medication that take care of these chemical imbalances, basically, and help alleviate the headache. So then we're not only looking at them for the acute treatment of a headache when you have it, but also looking at some of the studies as preventative medication as well.
So Sheila asked, where do I sign up for the study? So Sheila, there's a link below the video, and there's a phone number you can call anytime and leave a message if there's someone not there. But they're there all the way through Saturday during the week.
Yeah, or you can go to the web page and there's a link to there. You can sign up. Somebody will contact you and assess your interest and see if you're qualified. We're going to be running right now, I think 4. We might be doing up to 6 migraine headaches. That's the amount of interest that there is in developing these new drugs. And we'll put you in the database. If you don't qualify for one, we can certainly get you maybe into something else as well.
You're looking for a specific age group?
Currently, we're looking for patients between 18 and 75. Most migraine headaches actually begin in adolescence. They tend to peak in people in their 30s. Women outnumber men 3 to 1 typically in terms of having migraine headaches. So migraines can actually continue for people into their 70s, but the common age group that we see is anywhere between 18 and 40.
So CB Logan asked, hemiplegic
migraine. Yep, it's almost like you're having a stroke. I mean, it can affect one side of the body. So migraines can manifest themselves in many ways, but that's one subclass of migraine headaches. For these type of studies, I know hemiplegic migraines are an exclusion, so those patients who experience just that type of headache would be excluded.
So they couldn't do the study?
They couldn't do this particular study, yes.
Okay, that's a good question then. Can people earn money doing these studies?
As with any research study that we do, patients are compensated for the time they take out to come into the study, to do the studies, for the time that they travel. It really depends on the complexity of the study, what's involved in the study. So rather than give you a blanket amount, basically it's advertised. We do let the patients know what they will receive, but it's really based on the complexity of the study and the time that the patients put into the study.
Why should someone do a study?
Well, unfortunately, these days, the treatment of migraines, even though it's progressed, the understanding more of what chemically is going on inside the brain during a migraine headache has helped try to develop these new drugs for headaches. I mean, your typical treatment for your migraines is take a Tylenol, take an ibuprofen. Even some people get addicted to the opiates in terms of severe headaches. And migraine headaches can range from 2 a month to sometimes 15 a month. So imagine having a headache every day, and then, as we discussed, not just your regular migraine, having a throbbing migraine headache where the light bothers you, you're nauseous, you're vomiting, you can't go to work, you can't function. So a lot of the work that's been done already, there's triptans that have been developed, nasal sprays, injections, even Botox has been looked at in terms of migraines, but nothing really takes care of the chemical imbalance that takes place in the brain. So this whole new class of drugs offers a lot of promise, and a colleague of mine who's a headache specialist in Minnesota really says that this class of drugs could change the whole treatment of migraine headaches.
What causes it? Is it genetic? Is it something that your diet?
Well, there's a strong family history of migraine headaches. Again, women seem to outnumber men 3 to 1. A lot of people believe that's hormonal. Okay, and family history. But again, we know now more than ever the exact chemical imbalance that occurs in the brain. And what happens is that chemical imbalance leads to the blood vessels actually opening up that feed the brain. That's what causes the pulsation and the throbbing type thing. And those same chemicals activate pain sensors in the brain, which give you that severe pain. I mean, if you look back historically, people said drink a cup of coffee, because coffee would constrict the blood vessels, and that was used as an early treatment for migraine headaches. But now again, taking care of the pain is important, but none of this takes care of any of these chemical imbalances that we've been talking about.
Are migraines treatable, or are they curable or only treatable?
Well, they're certainly treatable. We're looking at treatment, but we're also looking at prevention. So this new class of drugs is looking at both. So the studies that we undertake will be looking at both types of headaches, both active treatment in terms of if you have a migraine, but also looking at preventative treatment. And patients who do the active treatment, where they get a headache and we treat and we see how they do the medication, they have the potential on some of these studies to roll over into the preventative study. So if they feel that they get something that works, they have the opportunity to roll into a preventative study.
Yeah, CB Logan says, when I was at St. Luke's with hemiplegic migraines, they gave me a cup of coffee. So
yeah, that was one of the earliest treatments. And some of the active pills, a drug called Fioricet, which is a combination of barbiturate for pain, Tylenol for pain, and caffeine. That's what's in that pill. So that's still used in treatment of migraine.
What can trigger migraines? Do they just occur, or is there something that triggers them?
Okay, well, hormonal changes are big. I see women who have, we call them menstrual migraines. Around their period, they tend to get headaches. Certain foods, aged cheeses, salt, highly caffeinated beverages seem to cause that as well. Alcohol is another thing that can trigger. Stress, bright light or sun glare. So some people who are driving into the sun sometimes, bright glare can actually trigger a migraine headache. Change in sleep patterns. Shift workers sometimes can see that. Changes in barometric pressure. So just before a thunderstorm or rainstorm, some people notice that is something that can trigger a migraine headache. And again, even the birth control pill medication can actually lead to migraine headaches as well.
So Kelly asks, why is it when I get migraines I can't speak?
Well, either you're in a lot of pain, but again, you got to think the whole brain is kind of gone haywire. Think about everything firing at the same time, and like I said, there's different subset of migraines, so that may be one of the symptoms for her in terms of her migraine.
Does it? If you keep getting migraines, you don't treat it. Can it do permanent damage, or just something you just deal with?
No, usually not. It doesn't lead to stroke or anything like that, but most people that experience migraines on a frequent basis want to get them treated.
Jennifer asks, is it normal to get headaches every day, or are they a migraine?
Well, again, a headache, for just a regular headache, number one cause for a regular little headache is errors of refraction, so get your eyes checked. But a migraine headache typically, like I said, involves what we call an aura. An aura is flashing lights or sound bothers you, and then you really get that pulsating, throbbing, it feels like somebody's banging on your head with a hammer. We can all have tension headaches and typical, errors of refraction, we call them, where you need glasses, that kind of thing, or stress headaches. But a migraine really has all the other symptoms: nausea, vomiting, and again, this aura. Most headaches, migraine headaches, have that aura where patients will describe flashes of light when they get these type of headaches.
So if someone's out there getting headaches, what would be like a good checklist? Say, yeah, these are migraines, not just headaches.
Well, there's an international classification for migraine headaches, so all they'd have to do is call up, talk to us about their symptoms. If we feel that they should be screened for migraine headaches, we'll bring them in, go through the checklist, go through the diagnostic sheets, and this is a clinical diagnosis, so you'd have to see a physician to really make that diagnosis.
And the medical care is free?
Medical care is free.
So if you have migraines out there, you can call the number, go to the website, get checked out. You get a lot of headaches every month. You never know, it could be migraines. Maybe you can tolerate more than most people, so you don't know they're migraines, but get it checked out. So Don Smith asks, I have epilepsy with bad migraines. I need some help if anyone has some. So could Don, something like that, epilepsy wouldn't...
Absolutely, epilepsy would exclude you from doing the trial, because if you have two neurologic conditions, sometimes it might be hard to differentiate between those two. Some people don't have full-blown epilepsy but have mild attacks, and it might be misconstrued as being part of their migraine. So when we do research studies, that wouldn't exclude in the future, if these class of drugs get approved, possibly it's something that you could take. But in terms of doing the research, you have to really focus on patients with strict diagnosis of migraine.
So Dawn should go to her MD.
She should see probably a neurologist, yes.
And see, okay. So that looks like all the questions. So let me just, I'll go through. So someone calls in, they qualify for the study. How long about is each study for someone on average?
Well, typically the acute treatments are, we screen the patients, they wait maybe a week, they go home with the medication, and they literally go home with the diary. Because most migraine headache studies, the endpoint, or what we're looking for in terms of whether the drug works, is how they feel at 2-hour time point. So typically they'll assess their symptoms when they get them, and then we look over a period of time, 2 hours being the main point, but we extend that out, and they complete a little diary. And it's something they do on like a tablet that we send home with them. We call it an electronic diary. And they basically check off mild, moderate, severe, how do they feel? So we're going to ask them, do you have the aura with the flashing lights? What's the intensity of your headache? Do you have any nausea, vomiting? So we look at, that's how these things are determined to see if they work. So 2-hour time point's important, but we look at them later. So once it's a single treatment in terms of these headaches, once they complete that, they're basically done. And like I said, for some patients, depending on which sponsor we're working for, if they get to treat a headache and there's the opportunity to participate in the preventative, or what we call prophylactic arm of that trial, we can actually enroll them into that second study.
So it's important to note, because I've been talking to you for a couple of years now, you get free medical care. You understand you'll understand migraines pretty well, because they're going to have one-on-one care.
You learn a lot about your disease by doing these studies, because just like we did today, we educate the patients about what the drug does, what is a migraine. Just filling out a diary, just assessing your migraine, puts you more in tune with what your migraines are all about. So, and we're always here to answer any questions that the patients have to ask. No, there's no stupid questions. We answer everything there is. So they learn more about their disease. They have access to the latest types of medications, because the feeling is that these class of drugs will make it to the marketplace. But by participating in the studies, they help us get there. So it's a very important thing, not only for themselves, but for other people that suffer from migraines as well.
And they earn money.
And you do get compensated for your time.
So Suzanne Braga asks, why do I get headaches a few hours before getting up in the morning, sometimes turn into a migraine? Awful. Is that just dehydration or something?
Yeah, it could be, but one thing I always tell patients is, like I said, the most common reason for regular headaches is your eyes. Those happen at the end of the day. Migraine headaches can happen any time of the day. So people can wake up in the morning with migraine headaches.
So either too much sunlight, or maybe wearing sunglasses, not getting any?
As we said, sun glare or bright lights can sometimes trigger. So everybody has different triggers. And like you said, even just changing the weather can sometimes trigger a migraine.
So Ann says, I've seen everyone, not Dr. Miller, I don't think, and I still deal with migraines and dizziness 24/7 for the past year now.
Well, again, we talked about some of the limitations of the medicines that are out there. I mean, if you look at what's out there in terms of prevention, there's a class of drugs called beta blockers. They're heart medications. Again, the purpose of those is to stop the blood vessels from dilating. But they tend to make people slow down and drowsy, and you lose your energy with that class of medication. All these other drugs have side effects. And if these things work, we probably wouldn't be doing these types of studies. So nothing's perfect. You don't want to see patients addicted to painkillers on a regular basis. So that's why the type of studies we're doing is not only the acute treatment, but also looking at prevention. Because prevention's always better than the cure.
But Ann sounds perfect. So call Ann or click on the link and fill out the form. I have really bad migraines and I have triggers. So triggers are just things that onset migraines, right? So Susan sounds perfect. Heidi says my triggers are perfume, cigarette smoke, heat, hormones, etc. So
yeah, hormones
common.
are up there. Yep.
Yep. So Heidi, same thing. I would call and check. If you have questions, post them in there. Camry says painkillers are migraine rebound triggers. I don't know what that.
Well, the pain medication, again, just takes care of the pain center in the brain. It doesn't take care of the neurochemical imbalance that you see in the brain, and that's what these drugs are targeting. So again, pain medicine will wear off. That doesn't mean the active process that's going on in your brain is not continuing. So it's not so much of a rebound, it's just that the pain medicine masks the symptoms, and then the migraine has just continued. Because migraines, like we said, typically last hours and sometimes days.
So Camry also says the weather is a trigger, and that's
Yes.
a big one, right? Okay, so that's it. I don't see any other questions. So study is pretty simple. Call, see if you qualify, come on in, get free medical care, get paid to do it, and then learn about migraines from the best in the area. Where are you located at, Dr. Merrill?
We're at 49 State Road in the Watuppa building on the second floor.
So it's kind of near, right on Route 6, right near the 140, not
Next
too
to
far
Shaw's.
from there. So it's very close, right near New Bedford, Westport, Dartmouth, Fairhaven, and Acushnet. If you're in the South Coast area, perfect. So check it out. Thanks, Dr. Miller, for your time.
Okay, thank you.